I saw Dr. Mutha because I had very bad gastroparesis.
So Valerie Hemlin came to see me because of her symptoms of nausea, vomiting, abdominal pain.
And it had gotten so bad that I was only able to drink food. I couldn't drive, I couldn't walk very well, couldn't think. I was in a wheelchair.
So gastroparesis means delayed gastric emptying, wherein the food from your stomach goes very slowly into your small intestine. Generally, about 90% of the food in stomach will get out of your stomach into small intestine with a period of 4 hours. But in her case, that wasn't the case. Even after 12 hours, her endoscopy showed that all of the food that she ate 12 hours before was sitting in the stomach. So gastroparesis, generally you go on a gastroparesis diet, where you go on low-fat diet and low-residue diet. So that's one of the dietary recommendations, and there are a bunch of medications we try. And Valerie tried everything, but it did not really help her, and she was struggling. If these things don't work, then there are certain surgical options.
Dr. Mutha recommended a gastro procedure called a G-POEM.
There's this new procedure called G-POEM, wherein we go into the stomach, and where the stomach meets the small bowel, there is a muscular valve called pylorus, which kind of stays closed and opens up when food is nicely digested in the stomach to let it release into the small intestine. And in her case, it wasn't happening, so we go in and we essentially cut that valve to make the opening wider, so the food now enters into the small intestine.
I was not hesitant. I was desperate. I really had no other options. I was terrified that I'd have to go to a feeding tube.
But post-procedure, after the recovery, I saw her in clinic, and she said to me that her symptoms are improved by 90%. We have a scoring index where her score was 29 before the procedure, went down to 4. Lower the better, and she improved significantly.
I couldn't get around the house without a cane. Now I don't use it anymore. I'm able to think, I'm able to function. Now I walk 15 to 20 minutes after every meal, but I can eat very, very well cooked vegetables. I don't eat meat. Fruit, oatmeal, cereals. My diet has just exploded, and I'm thrilled.
I absolutely love what I do. The gratification I get when patients feel better, the brain fog disappears, they're able to eat, their life comes back to normal. Nothing is more gratifying than that, and I love it. I mean, it's a high-risk procedure, but I'm willing to take that risk because the results, when everything goes well, are phenomenal, and I love it.
I would say if your doctor has recommended the G-POEM, then do it. Especially here. Dr. Mutha's great. A big shout out to Dr. Ertan, Dr. Tasani, UT Physicians, and Memorial Hermann Hospital.